Using a blood glucose meter is an essential part of managing diabetes, and it's easier than you might think. First, let's talk about the meter itself. Make sure it's clean and ready to go. You'll need a test strip, which is like the little hero of this process. Take a test strip and insert it into the meter until you hear a click. That means it's ready to read your blood sugar. Next, grab your Lancet device. This little tool is designed to prick your finger and draw a tiny drop of blood. It might sound intimidating, but it's quick and usually doesn't hurt much. Load a Lancet into the device, twist off the cap, and choose your depth setting based on how sensitive your skin is. Press the device against the side of your fingertip and push the button. You'll feel a quick poke, and voila, you've got your blood sample. Now bring your fingertip to the test strip. You only need a small drop about the size of a pinhead. The meter will beep, and in just a few seconds, it'll display your blood glucose level. It's that simple. After testing, don't forget to dispose of the Lancet safely. Use a sharps container if you have one. Keeping your testing area clean is crucial for your health. Now let's talk about insulin. If your reading is high, you may need to take insulin. Always follow your healthcare provider's instructions on how much to take. Insulin can come in vials or pens. If you're using a vial, draw the correct amount into a syringe. If you're using a pen, dial up the dose and inject it into a fatty area of your skin, like your abdomen or thigh. Rotate your injection sites to avoid irritation. Remember, managing diabetes is a journey, and it's all about finding what works best for you. Regular testing helps you stay on top of your health, and with practice, it becomes second nature. You got this.